Tips from the ER. No eating. Are you upset with us because we said you can't eat anything? I'm so silly, I should have explained why. When you come into the ERs, we look for emergencies that need to be resolved. And sometimes they can only be resolved with surgery. And since we're not in some sadistic horror movie, we're gonna make sure you don't feel any cutting by knocking you unconscious with anesthesia. Anesthesia temporarily paralyzes your muscles so you have no reflexes. Crazy, right? Now imagine if you've just had some of your grandma's famous gumbo soup, but you need emergency surgery. That soup is gonna go to waste because it's gonna creep out of your stomach, up your throat, down your windpipe, and into your lungs. We all know that feeling when food goes down the wrong pipe, right? We have to cough like crazy to get it out of there. But except this time, you can't cough. Muscles are paralyzed. No reflexes, remember? What happens when you can't get food out of your lungs? You're gonna choke, and then you're gonna die. Now why would you want this to happen to you? We certainly don't. No eating in the ERs, motherfuckers. Tips from the ER. Code pink. If you've already been in the ER for 5 hours getting your finger sewn up because you had a little accident with a kitchen knife, be prepared to be there a little longer. If there's a code pink, we're locking this bitch down. No one's leaving because there's a baby missing. That's right, we couldn't get the slime off of it fast enough before somebody decided your baby was too cute not to take home. Code pink means someone stole a baby or the nurse accidentally gave it to the wrong mother. Either way, we can't find him and we're blaming everybody until the little poop monster shows back up. You can bet I'll be in the hallways looking at you, looking at me, looking for a baby. If you happen to see somebody holding a bundle of blankets with an umbilical cord hanging out of it, notify your nearest hospital personnel. If you happen to be holding a baby, you might get tackled. Even if that baby is yours, we can't take any chances. No hard feelings. Code pink!
Oh crap.
What?
My ex is here. It's Stacy.
Which Stacy? Crazy Stacy or boring Stacy?
Crazy Stacy.
Ooh, crazy Stacy. You really need to stop dating girls named Stacy.
She's checking in. Don't look.
Whoa, that's crazy Stacy? She's actually hot.
Why are you surprised that she's actually hot?
I think I would put up with crazy Stacy. How crazy was crazy Stacy?
Stop saying crazy Stacy. She'll hear us. I can't treat her. I haven't seen her since I dumped her.
You dumped her?
Yes. Deal with her. I'll get you a beer.
All right.
Wait.
What?
Let me know if there's anything I should be worried about. You know, pregnancies, STDs, that sort of thing.
Sure thing. Hi, ma'am. My name is Rich. Before we get started, can I ask you a question?
Sure.
What's the name of those sea creatures with really big claws? Crabs? I'm sorry, can you say that a bit louder? Crabs! Perfect. Hi, ma'am. So sorry to bother you, but we need to recheck your blood pressure. You know, you remind me of my third husband. Third husband? Wow, I'm flattered. How many have you had? 2. Tips from the ER. Fake seizures. Ah, yes. Usually a patient's last-ditch effort to keep themselves in the ER. Likely because we just told them we are done with their treatment and now they get to go to jail. That's when they drop to the ground and flop like a fish. Get off the floor, Richard. The officers are waiting. But some of you won't even put in that effort. You'll just go limp. That's when we take your hand, put it over your head, and drop it. If it smacks you in the face, all right, we believe you. You're unconscious. But most of the time, your hand will magically fall to the side and avoid your face. That's when we know, you's a liar, motherfucker. With real seizures, you won't care what starts hitting you. To prevent injuries from real seizures in the ER, we have what's called seizure pads that we strap onto the side rails to keep you from breaking your face or bruising your shins. Every ER I've worked at, we can never find the seizure pads when we need them, so we end up wrapping the rails with blankets and taping it together. It's quite ghetto, but it gets the job done. Tips from the ER. Things not to come to the emergency room for. A COVID test. If you are feeling sick with a sore throat, cough, and or fever, please stay the fuck at home. Because even if you got a positive test result and you indeed have COVID-19, guess what you should do? Stay the fuck at home. And if you're still unsure, ask yourself, in your current state, do you need a $30,000 ventilator machine to help you breathe? If not, you should stay the fuck at home. And if you motherfuckers are still confused, turn on the TV, look it up online, and you will see that the only thing that has ever been recommended to you was for you to, say it with me now, stay the fuck at home. Tips from the ER. Code SILVA. Away! Code Silver means someone in the hospital has a weapon and they're on the loose. So hide your kids, hide your wife, and hide your husband, because there's no telling what's gonna happen. This dangerous person could have a gun, a samurai sword, or a rubber duck. You never know. The wrong items in the right hands could be fatal. But it's probably a gun. Regardless, you need to be on high alert. So drop your shit and get to safety, motherfuckers. Not your literal shit, of course. Scared as you might be, you don't want to leave a trail for the shooter to come find you. Get to a hiding spot, lock the doors, and for the love of God, silence your phones. For another video on Code Silver, check out Dr. Karan Rajan's hilarious version.
Hello, how can I help you?
I need you to test this.
What is that?
It's my boyfriend's pubes on a towel.
Ew! Oh my god! I almost touched that with my mouth!
I need a paternity test to see if he's the father.
We don't do that here. This is an ER.
Well, then can't you send it somewhere? This is a hospital.
No.
I need to know if he's the father.
Why wouldn't your boyfriend be the father?
Because I'm sleeping with another man and I don't know who got me pregnant.
Ma'am, like I said, this is an ER. We don't do
Are you really going to deny a pregnant woman?
No. Of course not. Let me just put this glove on and I'll take that from you. Hey, Austin, catch!
What is this?
Some dude's pubes on a towel.
Oh, gross! Rich!
Okay, all done. Test determined, he is the father.
But how? You didn't even get my DNA or the baby's.
Oh. Right.
If you aren't gonna test it, I want that hair back and I'll go to the hospital down the street.
Well,
I am not leaving until I get that hair back.
of course. Let me just put some gloves on. I'll be right back. Austin, where'd you put that towel?
I burned it, Rich. Go away.
Ugh. Fine. Okay.
Oh!
Okay. Here you go, ma'am. I found it.
Finally, useless. I'll find out who the father is myself.
Good luck with that. Hello, ma'am. My name is Rich. What brought you into the ER today?
I've been vomiting all morning.
I'm so sorry to hear that. We're gonna get you back and get you some nausea medication right now, okay? When's the baby due?
What baby?
Oh. I thought, because of the vomiting and morning sickness.
Do I look pregnant to you?
Well, no, but Shut up. That's fair. You know what? I'm just gonna bring you back. Yo, Ben, have you seen Austin? I just gave him a new patient in room 2. He went to the bathroom. Just leave him in there. Sir, do not pull out your IV! Okay, but she's here for vomiting, not pregnancy. Vomiting and pregnancy. Got it. Sir, I said stop! Okay, cool.
Hey, Ben, I'm back.
You got a new one in room 2. Something about vomiting and pregnancy.
Oh, okay. I'll go say hi. Hi, ma'am. My name's Austin. Are you expecting a boy or a girl? I am not pregnant! Oh. No, I meant, are you expecting a boy or a girl nurse? What? It's a new question we're asking. We want to make sure you're comfortable with who's taking care of you. And are you a boy or a girl? What? I can't tell if you're a boy or a girl. It seems like you could pass for both. Ma'am, I'm a boy. And I am not pregnant. Okay, I'm sorry.
Alright, what do we got? Unidentified female walking around half naked and talking to herself in front of the 7-Eleven on 5th and Broadway. We're not sure who called it in, but we're guessing it was the guys at 7-Eleven. Anything wrong with her? Nah, she was just scaring away the customers. I went to, and then it went, I didn't. Okay. She has some stuff in these garbage bags, but we're not sure where her pants are. What is that cord under her? Cord? Oh, that's definitely not under her. Whoa, that's coming out of her hoo-ha! Oh. Hey, I have one of those. That's an Android charger. Do you need another one? No. She didn't even flinch. Hey, you think maybe she was just trying to, recharge? Whoa! Good one. Hey, Rich, do you have a phone charger? iPhone or Android? iPhone. Ah, darn. I only have an Android charger. Damn, what's with these Androids? You and Austin. Austin has an Android? Yeah. Really? Where is he? Sir, the doctor is done evaluating you. There's nothing more we can do. I'm not ready to go yet. He didn't even do anything. We've ruled out anything emergent. You're gonna have to follow up with your primary care doctor. I'm sorry. Here are your discharge papers. Man, shut up, you stupid chink. Fuck these papers. Get me some medicine. Sir, are you gonna leave or am I gonna have to call security? Ugh. Hey, have you seen security?
No, what's up?
This guy in room 2 refuses to leave, and he just called me a chink.
Whoa, not cool. Okay, stand by. I'll find security.
Cool, thanks. Okay, sir, security is on their way. Oh, look who's back from China like COVID. Seriously?
Sir, that is enough. It is time for you to go. Psh. You will not speak to anybody at this hospital like that. Do you understand me? Now kindly pick up your stuff and leave.
Thanks, Austin.
Sorry I couldn't find security.
I don't think we needed them.
I got your back, Ben.
Hello, my name is Rich. What brought you into the ER today?
I have a stomach ache, and I've been throwing up all morning.
I'm so sorry to hear that. We're gonna get you back right now and get you some nausea medication, okay?
Can we wait for my mom? She's parking the car. Oh my goodness, there you are. Hi, sir. I'm Mom.
You're just in time. We're about to bring him back.
I brought his vomit in case you need to see it.
What? Oh my god.
Do you need to see it?
No, please throw it away.
Well, shouldn't you show it to the doctor at least?
No, they don't want to see it.
What should I do with it then? Throw it away! Help! Well then why did I bring it all the way over here? I don't know! Help! I want someone to see it! Fine!
Yo, Austin, what are you doing? Can you help in triage too?
Sure thing, I'll be right there.
You bitch. Welcome to the ER. How can I help you?
I'm 21 weeks pregnant and I'm really worried about my baby.
Oh, okay. Let's get you up to labor and delivery right away.
Please hurry.
Really quickly, just tell me what happened.
I swallowed my chewing gum and I'm afraid it's gonna choke my baby.
I'm sorry, what?
Babies aren't allowed to eat for the first 6 months. What if he starts chewing on the gum in my tummy and chokes?
Hello? Yes, sorry, 1 second. Is there anything else going on besides the chewing gum?
No.
Great! Hey, I'll call you back. So, your baby cannot choke on the chewing gum that you swallowed.
Are you sure?
Yes, because your baby is not growing in the same part of your body as where your swallowed chewing gum is. Okay? They're in different places.
Huh?
Your baby is in your uterus, and the chewing gum that you swallowed is in your stomach. Your baby cannot get to the chewing gum. It cannot choke on it.
Oh, well that's great news.
Isn't it?
How you doing in here, Jenny? I still feel nauseous. Well, it makes sense. We got your test back. You're pregnant. What? I can't be pregnant! Why not? Because I just graduated! No, I'm the first in my family to graduate high school! I have to go to college! You could still go to college. There's a lot of options you have with the pregnancy. How can I be pregnant? I don't understand. Are you sexually active and using birth control like condoms? My boyfriend doesn't like using condoms. We've been using spermicidal foam. Spermicide isn't always 100% effective. It's actually one of the least effective ways to protect yourself during sex, especially when used by itself. You should always use it with a condom. Well, for as bad as it tastes, it should work better! What? You're not supposed to put it in your mouth. Where do you put it then? It goes in the vagina. 10 to 15 minutes before having sex. How was I supposed to know that? There's usually instructions on the box. Are you sure you're ready for college?
Welcome everybody, today we're going over CPR. Who knows what song you should use for CPR? Paige? Paige, this is no time for dancing, we're losing the patient. Libs, show her how it's done.
Now from the top, make it drop, that's some wet and cushy. Now get a bucket and a mop.
Libs, we are trying to revive the patient, not make her booty pop.
I'm talking wop, 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 that's some wet and cushy.
Can we get a professional in here? Blake?
Peace up, A-Town down. Yeah!
Blake, please, this is a hospital. Usher is too sexy and inappropriate. Can someone be serious? John?
It's about damn time. In a minute, I'ma need a sentimental man or woman to pump me up.
Lindsay?
Gonna be honey too. It's a real live boogie and a real live hold down. Don't be a bitch, come take it to the floor now. Woo!
Enough! We are not having a hoedown in the hospital. You are all fired.
Alright, what do we got? 36-year-old male found down in the middle of a park. We suspected an overdose, gave him some Narcan, and well, he woke up. Let me out of these! We also put him on 4-point restraints. Ah! I see that. Sir, do you remember what happened? Where's my stuff? If you lose my things, I'll sue you! We have your things right here, Bob. He's 8 no times 4. Perfect. Hey, Bob, I'm gonna be your nurse. If you could try to relax, I don't see why we can't take these restraints off you. Deal? Let me go! Ah! Bob, can you look at me? I'm just trying to help. You look like a stupid piece of shit! Get fucked!
Patient aggressively advising this RN to, quote, get fucked. I'll kill you if I ever get out of these restraints, end quote. RN advises patient that patient's statements go against hospital policy on creating a safe work environment. Patient again informs this RN to, quote, get fucked. RN declines. Medication requested. Will continue to monitor.
Excuse me? I'm having chest pain.
Right this way, ma'am. We're gonna do an EKG.
Please hurry.
What is this bandage on your chest?
I had a biopsy to check for breast cancer a few days ago.
The scar looks fine to me. Let me grab the doctor. I'll be right back. Hey, Doc.
What's up, Ben?
I got a lady with chest pain in room 2. She had a breast biopsy a few days ago. The scar looks fine. Her heart rate's a little high, but the EKG looks normal.
Alright, I'll be right there. Hi, ma'am. My name's Dr. Wang. I understand you're having some chest pain. Ben filled me in. Everything looks pretty normal right now. I'm gonna check your scar. We're gonna get some blood work and a urine sample from you, okay? Okay. Have you been using any drugs? Drugs? What do you mean drugs? Meth, cocaine, nicotine, Adderall, vapes? No! I have been sober for 7 years! I would never! I just have to ask, ma'am. I didn't mean to offend you. Why don't you learn to do your job instead of assuming all patients are on drugs, asshole? Ma'am, it's just a standard question in the ER. There's no need for name calling. Fucking asshole! I'll be back.
What the hell was that?
I don't know. She just blew up on me.
She wasn't like that in triage.
Huh.
What do you want to do?
Get a tox screen on that urine sample.
You think she's lying?
Only one way to find out.
Ma'am, your lab results came back. They found meth in your urine.
What?
Do you have any idea how it got there?
I relapsed last night. Fuck!
I see.
After 7 years! I feel so stupid! This breast cancer has gotten me so stressed out!
Look, staying sober isn't easy, but we're gonna get you help, okay? For everything.
I'm sorry.
You don't have to be sorry. People relapse. Many people do. I promise you're not alone.
Okay.
I'm gonna bring the doctor back in and we're gonna figure this out. You're gonna be okay.
Entered patient's room to find patient standing on bed, naked, swinging his call light above his head like a helicopter and urinating onto the floor. Patient was asked to come down from the bed, to which he replied, quote, George Washington is in the shitter. Medications requested. Security notified. Patient refused height measurement and states he is 7 foot 11 inches. Patient does not appear to be 7 foot 11 inches. Will measure again when patient is more agreeable. Patient told this RN to, quote, suck my dick. Patient refuses to see Dr. McMillan because he shares the same first name as their cheating ex-husband.
Informed patient that there is no other doctor available. Patient has decided to leave against medical advice. MD aware. Patient arrived by ambulance and verbalized, quote, "Fuck you, motherfuckers. I'm gonna kill you, fucking assholes." End quote. Patient seemed to be agitated upon assessment. Patient given crackers and has since calmed down. MD notified. Will continue to monitor.
Alright, what do we got? 26-year-old female fell off her horse while she was training for a competition. She's got a pretty nasty leg injury. Ah! Help! It hurts! Okay, let me just take a look real quick. Oh! Wow! Is it bad? I've seen worse. It's bad. Can you feel this? Yes! Yes, that hurts! Okay, yeah, it's bad. We should move fast. Ow, 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 just fix it, please! Do anything! Can you help me cut these boots off? Like hell you are! What? You are not cutting into my Parlanti Roma riding boots! Your what? You see what I've been dealing with? Good luck. Ma'am, we have to cut your boots off to see your leg. No, just pull them off. There's a zipper. Your leg is very swollen. If we try pulling off your boot, we risk damaging your leg beyond what it already is. You listen to me. I have spent over $1,000 on these boots. I have broken them in for the past 5 years, and I have scrubbed and oiled them after every single ride. If you are making me choose between my leg and the boots, I would rather lose the leg.
What's going on in here?
She's refusing to let us cut off her horse riding boots.
Really? What kind are they? Parlanti Roma equestrian field boots?
Yes!
Oh, yeah, those are seasonal. You can't cut those off. We're gonna have to figure something else out.
What?
Patient refuses to allow staff to cut off horsey riding clothes. Attempted to educate patient that if patient's clothes don't come off quickly, hospital staff could miss an injury underneath patient's clothes, which can cause further harm to patient and potentially be fatal. To which patient replies, quote, "If I have to choose between me and cutting off my horse gear, then just spread my ashes over my horse pasture." End quote. Psych consult requested. Will continue to monitor.
Hi ma'am, my name is Ben. What brought you into the ER today?
I'm having a really bad stomach ache.
I'm so sorry to hear that. We will need a urine sample from you to rule out a UTI, okay?
Oh, but I'm on my period.
Oh, that's okay. There's some wipes in the bathroom. Make sure to really clean your area. Wipe away as much of the dry blood as possible, and always wipe from front to back. When you start peeing, catch the urine midstream. You don't want any from the beginning, okay?
Oh, okay. Thanks. I didn't know that.
No problem. Oh, and don't fill the cup all the way to the top. Half cup is more than enough.
Okay. I'm all done. Here you go.
Great. Oh, it's full.
I know, I panicked. I'm so sorry.
No, that's okay.
My aim isn't very good either.
I'm gonna get a towel.
I'm so sorry.
Trust me, girl. You're not the first person, okay? I'll be right back.
Thanks, Ben.
Tips from the ER. 3 ways to be the perfect patient in the emergency room. Do not pee without telling us.
We need that urine.
A quick test of your urine is one of the best and easiest ways to find out what's going on with you. If you pee without telling us, we will wait for you to pee again. And that could be the difference of hours in the ER. Do not try to get up on your own if you are unstable, especially if you've just been given pain medication. Pain medication in the ER can be very strong and will make you dizzy. If you try to stand up without assistance, fall and hit your head, you could potentially be stuck in the ER for something much worse than what you initially came in for. Do not leave your bed or the ER without telling someone first. If you need to use the bathroom, make a phone call, or you've decided you've had enough and you want to go home, tell us. There is already a million things going on in the ER, and looking for your hairy butt is not something we'd like to add to the list. And if you leave the ER before we take out your IV, we will call the police to hunt you down. Dorothy, are you sure you don't have anything metal below your waist? No, I don't think so. Well, we got your x-rays back, and there's definitely something metal in your pelvic area. Are you sure you didn't have any surgeries or maybe put something up there? No, Oh, you know what it is. Is that a dollar bill safety pin to your underwear? It's in case I need to call a cab. I see. Well, hold on to that, and we're gonna do the x-rays again, okay? Can you hold it for me? I don't want to lose it. Of course. Let me get some gloves. Oh, heads up. Boss is here.
Boys, please stay off your phones at work.
Yes, Elizabeth. Yes, Elizabeth.
How's Austin been doing?
Better than expected.
Good. Make sure he puts his name on the whiteboards. I want the patients to know who's taking care of them when they're here. I'll make sure he remembers. And put your drinks away. I saw that too. You boys know better. Yes, Elizabeth.
Yes, Elizabeth.
I'll be in my office. It's like a freaking prison in here.
That's a little dramatic.
Hey guys.
Ugh. What's up, champ?
Did you see Bed 2's x-ray? The guy got a wine bottle stuck up his butt. Tried to use a coat hanger to fish it out. Now they're both stuck.
Nice. Pull it up.
Whoa.
Oh my god. Let's get a picture.
Yep.
You can't take pictures?
Relax. How do you think these pictures get on the internet?
By the way, Elizabeth came by. She says put your name on the whiteboards and keep off your phones.
Welcome to the ER, sir. How can I help you?
Are you guys able to remove things that are stuck in someone's body?
Oh. Did you get something stuck down there?
What? No, nothing crazy like that.
My apologies, sir. Just tell me what happened.
I got a bullet stuck in my forehead.
Oh my god, what?
Oh yeah, but I'm fine. Just decided it's time to get it out.
Were you shot? How did this happen?
Well, a couple months ago, I was shooting my AR in my yard like I always do, and I was standing a little too close to the target. Long story short, the bullet ricocheted and nailed me right in the forehead.
This happened a couple months ago?
Sure did.
Why didn't you come to the hospital when it happened?
I figured I was okay, you know? It wasn't that bad, and I thought my body would just push it out on its own, like a splinter.
And have you been experiencing any pain, headaches, or lightheadedness?
Nope, I feel totally fine. I just want it out.
That's amazing. What made you finally decide to get it out now?
Oh, well, I'm getting married this week, and I want to look good for my photos, or the future missus is gonna kill me.
I see. Wow. Okay, well, have a seat. We'll be with you soon.
Thank you.
Whoa, what are you doing here?
I'm working.
What do you mean working? Don't you have COVID?
Doesn't matter. CDC says I can come back to work if we're short nurses.
No, it doesn't.
If shortages continue, despite other mitigation strategies, as a last resort, consider allowing healthcare personnel to work even if they have suspected or confirmed COVID infection, if they are well enough and willing to work.
You are not well enough to work.
But I'm willing to work. I need the money and they're not giving any more paid time off for COVID.
Ben, no water bottles at the nursing station. It spreads germs and increases infection. Shouldn't you be more concerned that he has COVID? We're short nurses, Rich. The CDC says it's fine. I have an immunocompromised cancer patient right there. Ben could kill them. Ben, put a mask on and don't go near Richard's patients.
Got it.
Whoa, what's going on with Austin?
I think I gave him COVID a few days ago.
What? Why is he here?
We're short nurses. Also, he's new and has no vacation time.
What is happening?
How long was I out? Hi, sir. What brought you into the ER today?
The bugs are back.
The bugs?
They're all over my legs, and they're sores too.
How long has this been going on for?
A few weeks. I came in about 2 weeks ago for the same reason too.
Oh.
But I put canned gravy on my legs because the bugs like it.
You did what? Why?
My brother brings me canned goods. I thought by putting gravy on my legs, it would help my leg wounds, but I realized the bugs like it too.
Okay. Let's take a look.
Here you go.
Oh, God! Dude! Oh!
What is it?
Sir, you need to stop putting gravy on your legs. These are maggots. They're literally eating your legs.
I know.
What do you mean you know?
Like I said, I was here about 2 weeks ago for the same reason.
They didn't tell you to stop putting gravy on your legs?
They may have mentioned it. I just thought it'd be a good idea.
No! No more gravy on your legs!
Alright, I'll stop. How was I supposed to know?
Hi, welcome to the ER. How can I help you?
My privates are itchy.
Oh. When did it start?
I saw a doctor for it already. He gave me a cream. I just need help rubbing it on.
Why do you need someone to help you put it on?
I can't see it.
Okay. Why don't we just get you back and I'll find someone to help you.
I prefer a female.
There are no female workers at this time.
You'll do. Tips from the ER. Texas abortions. Move aside, Florida. Texas has officially taken over as the most outrageous place in the country. And it's not because their state motto is friendship, which it totally is, but because they have just banned abortions if you are more than 6 weeks pregnant. First of all, who the fuck can tell if they're pregnant after just 6 weeks? I've seen women come into the ER 40 weeks in, damn near ready to give birth, and neither one of us could tell that she was pregnant. You motherfuckers want to cut them off at 6 weeks? At this rate, women will have to make an abortion appointment every 5 weeks just to make sure they don't need one. Even President Joe Biden managed to wake up from his 5th nap of the day and shake off the dementia just to tell Texas, guys, this is too much. All you my body, my choice people better get to protesting. You motherfuckers thought asking you to get a vaccine was bad. This has got to be one of the worst violations of your right to choice we've ever seen. And it is not going to end well. If this keeps up, Texas will have to change their state motto from friendship to coat hanger. Tips from the ER. Code Brown. I know what some of you sick motherfuckers want this to be about, but you could shit the bed all you want. Code Brown has nothing to do with poop, unless that poop is falling from the sky, because Code Brown means there's a severe weather warning. That's right, motherfuckers. Tornadoes, hurricanes, blizzards, floods, whatever Mother Nature decides to kick our asses with, the hospitals will have one big decision to make. Shelter in place or evacuate. If a hospital is in the direct line of a tornado, you could bet your ass they're gonna evacuate, which won't be easy. We could barely get your senile grandma up to go to the bathroom. How do you think we're gonna convince her to run away from a tornado? If a hospital decides to shelter in place, they're gonna shut down all non-essential services and elective surgeries. So your boob job is just gonna have to wait, AA. As for the ER, we're not shutting down until that tornado hits the doorstep. We're essential. We don't get paid any more than anyone else in the hospital, but when the time comes, we will be sacrificed for the greater good. Code Brown! Tips from the ER. Scabies. Nothing will strike fear into the hearts of ER workers more than the word scabies. A skin condition caused by tiny microscopic critters known as mites that crawl underneath your skin, lay their eggs, and eat you alive. They're also highly contagious, ready to jump from person to person as soon as there's skin-to-skin contact. That's why if you come into the ER with scabies, we will be covered up from head to toe to keep your little friends away from us. Those mites living underneath your skin will cause intense itching, to the point where you won't be able to sit still or sleep at night. First thing we're gonna do, get you the fuck away from everybody else. Get you a nice hot shower and kindly ask if we could burn the clothes you came in with. We then lather your body up and down with permethrin cream, the weapon of choice against scabies, proven to kill all adults, hatchlings, and eggs. Can't be afraid to kill the babies. It should be noted that scabies is caused by the female mites, proving once again that all females are parasites, just living to get underneath your skin.
Yes, Mr. Mickelin, how can I help you?
I gotta go. I'm dead.
Mr. Mickelin, we've already gone over this. You're not dead and you can't leave yet.
I am dead. There's no use for me here.
It's almost time for your medication, and I have to get your blood sugar.
How are you gonna get my blood sugar?
I'm gonna prick your finger for a drop of blood and then put it into my machine.
You can't get my blood. I'm dead. Dead people don't bleed.
If I can prove that you're not dead, will you please stop pushing the call light and go to sleep?
How are you gonna do that?
You said dead people don't bleed, right?
Of course not. Dead people can't bleed.
Give me your finger.
Ow!
Aha! What do you call that?
Well, I'll be damned. I was wrong.
I told you. Now please go to bed.
Dead people do bleed after all.
Tips from the ER. Dislocated fingers. If you've ever had a dislocated finger, you'll know it looks somewhere between half a holy cross and a crawling worm. Your ligaments are all fucked up, twisted, and turned out of place. But fear not, motherfuckers. Dislocated fingers are rarely ever life-threatening. You just gotta put it back where it belongs. Some people never even come to the ER. They just pop that finger back into place and keep on playing basketball. But if you're too squeamish and you need a little numbing medication, you can come on down to the ER. We'll block every nerve in that finger so you don't feel any pain, and we'll pull it back into place. To keep your finger from re-injuring itself, there's this really cool thing you can do at home called buddy taping. You tape that injured finger to a healthy finger so it has a buddy to move around with and make sure it doesn't get lost while it heals. Like this. Ha! See? It's a buddy. Welcome to the ER. How can I help you?
I, have a foreign body object stuck in me.
What? Where?
Up my rectum.
Oh, okay. Oh. What is it?
Easter egg.
Gotcha. Happy Easter. How did this happen?
I was doing an Easter egg hunt for my nephew and I fell on them.
Them?
Yeah.
How many did you put up there?
12?
And how many are stuck?
Like 5? Oh, wait. 4.
Have a seat. We'll call you in soon.
I can't sit.
Just stand over there, man.
What do I do with this?
Take it with you! Tips from the ER. 4th of July, also known as Independence Day. When America finally gave King George the finger and said, "Fuck off, Britain," we got our own flag to salute and kneel to. Celebrate this monumental moment by throwing on your star-spangled Speedos and choking down some barbecue wiener dogs. Make sure to lather on the sunscreen before jumping into the pool, or you're gonna end up in the ER showing off that patriotic sunburn. We will likely already be busy taking care of some blown off hands. Every year, there's always one person who will hold on to that firecracker for 1 second too long, and kaboom! Welcome to the ER. Fireworks are dangerous and they don't discriminate. Children, adults, grannies, someone will undoubtedly be in the ER missing some digits. How about we play it safe this year and stay the hell away from the fireworks? Don't do it for you or me, motherfuckers. Do it for your country. Okay, I'm here. Where am I going?
Morning, Ben. I'll let you guys decide. Room 2 is an old meth-addicted lady who's just brought in by ambulance for what's likely sepsis, and room 12 is a pediatric patient, but
I'll take the meth lady in room 2.
you don't have to run just because I said pediatrics. This is awesome. I love kids. No, but wait. Ah, come on. I wrote down information for you guys.
Alright, what's going on?
72-year-old female found down in her apartment, A&O times 2, fever of 102, and a heart rate that's been fluctuating around the 150s. We also put her on 5 liters of oxygen.
She definitely has an infection. Who called it in?
Her neighbors. They also told us an interesting story about her.
What, that she's a meth user?
Apparently, she's also a sex worker.
Like, currently or in the past?
Currently. It's the only way she could pay for the meth.
Who would... She's 72!
Some people have their kinks, Ben.
Ugh, I'm not even gonna think about it. Anything else?
She's also got a colostomy that's looking a little funky.
Oh yeah, it's really red. That's not good. Alright, we'll check it all out. Thanks, man.
Hey, Doc, did you see the lab results for meth lady?
Yeah, blood work's all negative.
I know. What do you want to do?
It's so weird. She definitely has an infection somewhere.
Did you see her colostomy?
I did. Definitely doesn't look normal.
Do you want to culture it?
May as well. I don't know what else to do.
I'll do it.
Thanks, Ben.
What the? Oh my god. Ben, did you see the results?
Yeah.
Ma'am? Ma'am, wake up. Ma'am, we found syphilis and MRSA in your colostomy. Have you been using your stoma for sex? Ma'am, that is extremely dangerous. You should not be doing that. A hole is a hole.
Whoa, Ben, you okay? I should have taken that pediatric patient.
That pediatric patient was 17 years old, 200 pounds, and combative.
Still a pediatric patient.
My meth lady was letting people use her stoma for sex.
Ew! Oh yeah, that's called the Philadelphia sidecar.
Why do you know that?
What? You guys never just get lost on the internet?
No.
Oh. Okay, well you should Google it. Not here though. At home.
That's gross. It's not gross, it's for learning.
I'm gonna go throw up.
Me too. I'm just trying to give you guys information. Ugh. I am so unappreciated here.
Okay, sir, just one more question here and we're gonna bring you back. Are you on any medications? I take gabapentin for my seizures. You mean gabapentin? Yeah. Okay, anything else? I've been on Rang-a-Dang for heartburn. You mean ranitidine? Yeah, that's what I said. Okay, great. Anything else? I take a Metropolitan every day for my blood pressure. Metoprolol? Yeah. Alright, what do we got? 23-year-old male, A&O times 4, presenting with rectal pain. He's got a toilet bowl brush stuck up his rectum, sir. How? Apparently he was sitting on the toilet constipated, sir. That's when he noticed the toilet bowl brush nearby. Decided to stick the handle up there to scoop out some of the poop. And what, now it's stuck? Yes, sir. The end of the handle was curved. Now it's snagged up in his, well, you know. Alright, sounds good. You need a signature?
Bongo la, bongo cha cha cha.
Hello, what brought you into the ER today?
I'm vaccinated.
Okay, so how can we help you?
I have my vaccine card here if you need it.
That's great, but what is your emergency?
I got my second dose 2 weeks ago, so I'm good. Pfizer.
Did you need help with anything?
Oh no, I'm vaccinated.
Tips from the ER. If you plan on getting frisky this holiday and stuffing your own stocking, make sure it has a flared base. This does not have a flared base. It is festive, looks fun, ribbed for your pleasure, but does not belong in your chimney. This looks fun. It's flared, but it doesn't have a flared base. Obviously, not a flared base. This candle holder, yes, flared base, and the right size. If you're feeling a little adventurous, here's a longer one. Also, flared base. You see how it can't get sucked into the hole? And for those at the top of the naughty list, we have this. Make sure to get a flared base, motherfuckers. Happy holidays.
Welcome to the ER. My name is Rich. How can I help you? I've been having a sore throat and it's painful for me to swallow.
Open up, let me take a look. Oh yeah, it looks infected. We're gonna run some tests, okay? Wait here.
1 hour later.
I'm back. So it looks like you have oral chlamydia.
What?
Chlamydia. It's an STD. I know what chlamydia is. You're saying it's in my mouth?
Yes.
But that's impossible. You can't get an STD in your mouth.
Of course you can. Watch.
Hey, Ben.
What?
You can get STDs in your mouth, right?
Yes.
You have oral herpes on your mouth, right?
They're cold sores.
Also known as oral herpes, though, right?
Yes, fine, it's oral herpes, but it only flares up when I'm stressed out, so stop telling people about it. It stresses me out.
See, you're not the only one. I don't understand how this happened.
Are you sexually active?
Sort of. Me and this new guy, we haven't gone all the way yet.
You can also get it from kissing or oral sex. Does this new guy have pain in his mouth like you?
No, not that I've noticed.
Then this came from his genital chlamydia.
Oh my god! I can't believe his genital chlamydia gave me oral chlamydia!
You can also get rectal chlamydia.
Really?
Oh yeah, if you want payback on your new guy, you should take your chlamydia mouth and lick his butt.
Or not. Can you cure this?
Oh yeah, just take some antibiotics. It'll go away. As long as you don't keep putting your mouth on new guys' genitals. But you knew that. I'm gonna go get your antibiotics. I'll be right back.
Ahem.
Richard. Hi, Ronnie. How's pharmacy life? Your patient's getting admitted. They need their medications updated. You mean our patient is getting admitted and needs their medications updated, right? Either one of us could do it, you know. We'll see. Hey, can one of you verify Bed 2's meds?
He will.
Okay, maybe you two can work on it together? She has a whole purse full of loose pills. I can't even tell what's what. She didn't bring a list with her? Nope. Good luck. Well, let me know if you have any questions. Whoa, 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 whoa. This seems like a pretty complicated list of medications. Don't you think a pharmacist is needed? I mean, drugs are your specialty. Oh no, the key to an accurate list of medications is communication. And you, Nurse Richard, are the expert at good patient communication. Goodbye. But, if you want to get better at communicating with patients, you should start right here, with this one. I don't have time for chit-chat, Rich. I have to go mix drips for a very sick patient in 12. I'm getting a new patient, so it looks like I'm busy too. Oh, hey, Rich, don't worry about that patient. They're going to a different hospital. What? Ho, ho, ho! Oh, and Ronnie, don't worry about the drips in bed 12. The patient's dead. What? Family pull the plug. Don't forget to verify the meds in bed 2, guys. So, it looks like we both have time now. It would appear so. You know, Ronnie, maybe if we worked on this together, we could knock it out quicker. No. Yeah, fuck that. I have a better idea. Do tell. Wait, what? Why me? It's your patient. And we're very busy, so good luck. Okay, ma'am, just one more question here. Any past surgeries? Nope. Mom! What? C-section? Oh, right. This thing. Hi, I'm Zach. Hi, Zach. So just the one surgery then.
Welcome to the ER. How can I help you? Oh.
Help! I'm pregnant!
What? How old are you?
12!
Sweetie, are you by yourself? How did you get here?
I go to school across the street.
Oh. Why do you think you're pregnant?
Because a boy touched my knee!
Well, that doesn't mean you're pregnant.
It was an accident. We were playing soccer.
Hey, no, that's okay. It doesn't mean you're pregnant.
Yes, it does. My mom told me if I let a boy touch my knee, I'll get pregnant.
Oh, no. Okay, don't worry. We're gonna figure this out, okay? I'm gonna call your mom. What's your name?
Jamie?
Hello? Hi, Miss Brown. My name's Austin. I'm a nurse in the ER. I have your daughter, Jamie, here.
Is everything okay?
Yes, she's here because a boy touched her knee and she thinks she's pregnant. Did you tell her that?
Oh my god, yes. I'm so sorry. I did tell her that. My other young daughter is pregnant and I was trying to keep it from happening to her. I'm so sorry.
That's okay. It's okay. Why don't you just come down and we'll explain everything to her?
Yes, I will be right there. Again, I am so sorry.
It's okay, ma'am. Yes, I promise. Okay, great. We'll see you soon. Wow.
Okay, who's ready to have a baby? That would be me. Please, get this thing out of me. We actually have a new system that will relieve your pain while in labor by transferring some of the pain to the father, if you're up for it. Oh. Yeah, okay, fine. Just get it over with. Okay, we'll start with 20% going to the father. Oh, that's a little better. Whew. Wow, I'm not feeling anything. Turn it up to 40, Doc. Okay, going to 40. Wow, I like this system. I don't feel anything. Oh, excuse me. Hey, what's up, man? Dude, I feel like I'm passing a kidney stone the size of a watermelon right now. Dude, you need to get that checked out. Turn it to 60, Doc. It's getting worse. Oh, dude, it's getting worse. Turn it to 100, Doc. Hello, my name is Rich. What brought you guys into the ER today? My husband here is having chest pains and refuses to get help. Honey, it's not that bad. You hush. I'm so sorry to hear that. When did the chest pain start, sir? Well, we took a walk in the afternoon. No, it started in the morning. As soon as he got up, he was complaining about the chest pain. I see. And sir, how bad is the pain right now on a scale of 1 to 10? It's like a 2 out of 10. I'm fine. No, honey, he always says 2, but I know him. This is more like a 7. Aha. Okay. And sir, is the pain more like a pressure or does it feel like a sharp pain? Well, you have to tell him the truth. It's more like a pressure, and the last time we were here, he got an EKG. Ma'am, I'm so sorry, but if I could just ask you to let your husband answer, I'm sure we can get through this a lot quicker. Oh, be my guest. Right. Okay. Sir, when was the last time you were here? Oh. I can't remember. I remember. Right. Okay. Sir, what medications are you on? Oh, I think one starts with a W? Or, wait, let me think. Sir, is there a history of heart attacks in your family? Yes. Sir, when is your date of birth? Oh, it just happened too. What month are we in? Oh, for the love of... April 5th, 1969. Wow, okay. Hi, ma'am. Would you like to answer the rest of the questions for your husband? Happy to.
Welcome to the ER, sir. How can I help you?
I slipped and fell on a water bottle.
Oh,
It's stuck in my butt and I can't get it out.
is it a plastic water bottle?
Yeah.
Okay, we'll get an x-ray to see where it is, and then we'll help you get it out. Hello?
Hey, Austin. You should look at the x-ray for bed, too. Water bottle butt guy wasn't exactly telling the truth.
What the... Sir, we got your x-rays back.
Do you see the water bottle?
We see 2 water bottles.
What? Oh! That's right! I have 2!
How did you forget that?
I put the first one up a few days ago. I guess I forgot. Can you get them both out?
Yes, the surgeon's coming down to talk to you right now.
Okay. Thanks! Welcome to the ER. My name is Ben. How can I help you? My crazy son won't let me go home. Dad, you have to get checked out. I just need a smoke. I'll be fine. He's been having chest pains. When did it start? Like 5 or 6 hours ago. Why did it take so long to get here? He insisted on taking a shower first. I wanted to be clean for the doctor. I'm not the doctor. Sir, does anything make it better or worse? Yeah, being here makes it worse. Am I right? Dad, be serious. Fine. You want to know what makes it better? A smoke and a little peace and quiet. Sir, you shouldn't be smoking if you're having chest pains. See? I told you! Yeah, but can we believe him? He said he's not a doctor. I'm just kidding, fella. He's a nurse and he knows more than you. Oh, come on, son. Take me home. You're wasting my weekend. No, we are not going home until we figure this out. What's the big deal? The big deal is I am not going to let my mom, who already has high blood pressure, die from stressing out over your stupid refusal to be checked out. Now shut up and listen to the professionals. It's a little harsh. Your son's right, sir. We should get you checked out. We're going to get an EKG, some labs, and an x-ray, okay? Follow me.
2 hours later.
Okay, sir, we got your results back. It looks like you've been having episodes of angina. Did he just say what I think he said? Angina. If these continue, it could lead to a heart attack. We're going to keep you here at the hospital overnight. Thank you. You said you've been having these pretty often? Yeah, but like I said, I usually just sit down, have a smoke, and wait it out. That's insane that you haven't had a heart attack yet. Hey, fella, since it's the weekend, can I come back Monday to start treatment instead? Dad! Hi, ma'am. My name is Rich. What brought you into the ER today?
My 6-year-old son here has a fever.
I'm so sorry to hear that. Oh, he looks pretty miserable. How high was the fever?
I don't know.
Were you able to measure it at home?
No, but he's really warm. I know he has a fever.
Okay, not that I don't believe you, but we are gonna measure it here. Under your tongue.
It's gonna be okay. Hold still, baby.
101.8. Yep, he's got a fever. Poor thing.
I knew it. Never doubt a mother's instincts.
Never do. Were you able to give him any Tylenol or Motrin before you came in?
No, I wanted you to see the fever.
Why?
I didn't want you to think I was crazy bringing my kid here without a fever. I don't want to be one of those moms that brings their child to the ER for no reason.
Ma'am, I promise you, if you tell us your kid has a fever, we will believe you. But for the future, if you want to save us both some time, go ahead and give him a dose of the Tylenol or Motrin before you come in, as long as you know he has a fever.
Really?
Yes, of course. It gets your kids feeling better and it lets us see how they respond to the meds.
That makes sense.
You know, even better, if you give the meds at home and he starts to look great afterward, it might even save you a trip to the ER at 2 a.m.
It is pretty late, isn't it?
It is, but it's okay. Just remember all of this for next time.
I will. Thanks, Rich.
No problem. Now, come on. Let's get your kid feeling better.
Babe, I have something to tell you.
What is it, honey?
I think I have an STD.
What? How?
I don't know. I was gonna ask if you knew.
No, I don't have an STD. Are you sleeping with someone else?
No, I swear I'm not.
How else do you get an STD then?
I don't know, but it burns. I'm scared. Can we please go to the ER?
Fine, we'll discuss this later.
Hello, welcome to the ER. How can I help you?
My girlfriend caught an STD cheating on me.
Babe, stop! I told you I never cheated on you.
How else do you get an STD?
Okay, how about we just take a look and run some tests? We'll figure this out.
I bet you it was that bitch Mary.
Mary is our friend. She would never.
I'll be right back. Okay, so good news is you don't have an STD.
What?
Really?
Yep, test came back. Nothing.
Then why is my crotch burning?
Are you by any chance using a new razor?
Yeah.
It looks a lot like a razor burn. It should go away in a few days.
Oh. What are you doing?
Hey, Mary, do me a favor and please disregard my last voicemail. Love you. See you Saturday. Bye.
Welcome to the ER. My name is Ben. How can I help you?
It really burns when I pee, and I have a stomach ache.
We'll need a urine sample from you. Can you give us one now?
What do you think it is?
It's probably a UTI. Are you having any abnormal discharge?
Yes.
It could also be an STD.
Ew, oh my god, no! There's no way!
Are you sexually active?
Yes.
Okay, then maybe we shouldn't rule out an STD.
I do not have an STD. I would know, so stop saying that. It's gross.
Uh-huh.
What?
Nothing. Let's just run the test.
1 hour later.
It's an STD.
That's impossible! Run it again!
I'm not gonna run it again.
That test is wrong.
Why are you so sure you can't get an STD?
Because I've only ever had sex with one person, my boyfriend.
And?
And we were both virgins before we got together.
So?
So it's impossible that I got an STD from him.
None of that makes any sense.
I need you to run that test again.
And I need you to call your boyfriend.
Run it again!
No. Tips from the ER. Halloween! It's time to get the candy ready, motherfuckers! Because of COVID-19 all but canceling Halloween last year, you know these trick-or-treating hooligans are gonna be coming back with a vengeance, and they will be asking for double the candy. So load up the Kit Kats, Twix bars, and M&Ms in your biggest Nerf guns and shoot them from a safe distance. Cause COVID is still real, and kids are gross. Halloween is the one day in the year where being a cosplayer makes any sense to me. Cosplayers are people who took Halloween a little too seriously. There, I said it. It's always a little tricky in the ER during Halloween. Some of your costumes are so realistic, we don't know whether to panic or applaud you when you walk in. Sir, is that a real bone sticking out of you? Or are you just really happy to see me? Regardless, your wait time will be 4 to 6 hours. Happy Halloween, motherfuckers! Stay safe out there.
Hello, ma'am. My name is Rich. What brought you into the ER today? I am having major chest pains. I'm so sorry to hear that. We're gonna get you an EKG and bring you back right now. A spot just opened up. Oh, thank goodness. I thought I was gonna have to wait. Nope, right this way. Okay, have a seat right here. The doctor will see you shortly. Oh my god, is that a homeless person? Yeah. You're not gonna make me sit here, are you? Isn't there another place I could be? Well, this is the only spot open right now, but you're more than welcome to wait in the lobby for a different spot. Okay, yeah, I'll do that. Are there a lot of homeless people here? In the emergency room? Yeah. Ugh, no, I'll wait. Okay. Excuse me, I've been waiting out here for over an hour. Ma'am, the only bed we had, you didn't want, and a couple trauma patients came in via ambulance, so it might be a bit longer. There is another ER literally a mile from here. I'm leaving. Okay, good luck. Hey Rich, where's that lady with chest pains? She just left, but a spot just opened up. Why was she out here for so long? She didn't want to sit next to a homeless person. Really? What a silly reason to delay care. I know! Welcome to the ER. My name is Ben. How can I help you? My eyes are really hurting me. They're really red. When did this happen? I think it started sometime last week, but it's really bad today. Do you remember getting anything into your eyes? No, nothing. Please help me. It hurts. Okay, just let me take a look. Are those contact lenses in your eyes? Yeah. Why didn't you say you had contact lenses? I don't know. When's the last time you took them out? I got them about 8 months ago. And you never took them out? No. Why? I really don't like my natural eye color. Even when you sleep? Yeah. Oh my god. Okay, take them out right now. Do you have something I could put them in? I don't want to lose them. We are throwing them away! Okay, but there's this guy I'm seeing, and he thinks this is my natural eye color. What should I tell him? Tell him you care so much about what he thinks you look like, you're willing to lose your vision for him. Oh, that's so romantic. Oh my god!
Ambulance is here. What do you got? Ooh, what happened to that guy?
NBA versus pole. Guy took his wife's Porsche to go visit his mistress, crashed it on the way home.
Talk about karma.
Yeah, wait till the wife finds out.
There you are, you son of a bitch!
Uh-oh.
You're cheating on me and you crashed my car?
Honey, please, not now. I'm in pain.
How long has this been going on?
Hey, guys, can we keep it down? There's other patients here.
You lied to me, Brian!
Oh, you sure did. The pain's too much. I don't even remember what happened.
You don't remember? You don't remember? I'll help you remember. Yeah! Take that back to your girlfriend, you little
48-year-old male MVA versus pole with chief complaint of fractured left femur and multiple hematomas. Upon returning from CT, patient's wife arrived and violently rips out patient's Foley tube as if she was trying to start a lawnmower. MD notified. Police report submitted. Surgery consult for reconstructive surgery in progress. Success seems unlikely. We'll continue to monitor.
Hi, sir. My name is Rich. What brought you into the ER today? I have neck pain. Okay. And on a scale of 1 to 10, how bad is that pain right now? 10. 10? Yeah, 10. Are you sure? It's really bad. I could barely move my neck. Okay. I'll be right back. Hey, Austin, how's your patient in room 2 doing? Not good. His leg is definitely broken and he needs surgery ASAP. It was a crazy car accident. I'm still trying to wash the blood off my hands. Perfect. What? Okay, sir. Follow me. This is your room right in here. Ah! Help! My leg! Ah! Oh my god! Oh, sorry. Wrong room. Wrong room. This way. This way. This way. This way. This way. Sorry. Was that white thing his bone sticking out of him? Yeah. Painful, right?
Yeah. So going back to your chart here, on a scale of 1 to 10, how bad is your neck pain now? Definitely not as bad as that last guy's. Really? I guess it's about a 9. Seriously? No, you're right. 9.5. What the f? Hello, my name is Ben. What brought you guys into the ER today? My daughter Sarah is having a lot of abdominal pain. And how long has it been going on, Sarah?
I've had it since last night.
Any chance you could be pregnant?
No way.
No way. Okay, just have to ask. I'll be right back. Sarah, we will need a urine sample from you.
Okay.
Ben, what'd you call me for? Can you tell the 17-year-old in room 2 that she's pregnant? Her dad is not going to be happy. Why? They're both pretty convinced that there's no way she could be pregnant. That always happens though. They never think they're pregnant, and then one day, boom, they're 6 months pregnant. Yeah, do you want to tell them? Yes, oh my god, I love seeing the look on their faces. Thanks for thinking of me. Always. Here. Hi ma'am, my name is Rich. We got your test results back, and it looks like you're pregnant.
No, that can't be right.
How did you get pregnant?
Dad, I'm not. I promise you. There's no way. I can't be pregnant.
Listen, Tiffany, I know this is very hard for you, but I have the results in my hands, and it's very clear. You are pregnant.
Who's Tiffany? I'm Sarah.
Her name is Sarah. Are you looking at the right person? I'm sorry. I'll be right back. You son of a bitch. Did you set me up? Yeah, but only because I'm always thinking about you. I hate you so much right now. Go do it to Austin. Austin, get over here. Hi, sir. My name is Rich. What brought you into the ER today? I have neck pain. Okay. And on a scale of 1 to 10, how bad is that pain right now? 10. 10? Yeah, 10. Are you sure? It's really bad. I could barely move my neck. Okay, I'll be right back. Hey, Austin, how's your patient in room 2 doing?
Not good. His leg is definitely broken and he needs surgery ASAP. It was a crazy car accident. I'm still trying to wash the blood off my hands.
Perfect.
What?
Okay, sir, follow me. This is your room right in here.
Ah! Help! My leg! Ah!
Oh my god! Oh, sorry, wrong room. This way. Sorry. Was that white thing his bone sticking out of him? Yeah, painful, right? Yeah. So going back to your chart here, on a scale of 1 to 10, how bad is your neck pain now? Definitely not as bad as that last guy's. Really? I guess it's about a 9. Seriously? No, you're right. 9.5. What the fuck? Hello, my name is Rich. What brought you guys into the ER today?
This is my daughter Sherry. She stepped on a nail outside.
I'm so sorry to hear that. How old are you, Sherry?
16?
We're gonna have to get you a tetanus shot, okay? Is there any chance you could be pregnant?
Oh, no way.
Sherry, do you think you could be pregnant?
Trust me, it's a no.
With all due respect, ma'am, there's really only one person here who knows the answer to that question.
Well, okay, fine.
Sherry, is there any chance you could be pregnant?
No, I guess not. But it's nice to know that someone thinks I could be. Oh, honey, I didn't mean it like that. Why don't boys like me? Honey, just because a boy didn't ask you to the dance doesn't mean they all don't like you. I want to be pregnant!
Okay, so definitely not pregnant.
Rich, are you available Friday night?
Hi, sir. My name is Ben. What brought you into the ER today? I need you to test my urine for meth. Did you accidentally take some meth?
No.
Do you think someone drugged you?
No.
Then why do you want to be tested for meth?
'Cause I'm worried about my meth dealer. I think they're cheating me.
What? What?
Well, some of my friends are testing negative for meth, even though they're buying meth from this one dealer.
You want us to run a urine drug screen to test the level of meth in your body? To see if your drug dealer is cheating you?
Yes.
Sir, we don't do that in the ER.
Why not?
Because this place is for emergencies.
Well then, I also have a really bad stomach ache.
How bad is the pain?
10 out of 10.
Fine. Okay, sir, your test results are back. You are positive for meth.
Really?
You're also positive for cocaine, marijuana, hydrocodone, benzo, morphine, and methadone.
Whoa, hey. I don't know how those got there.
Really?
Hey, while I'm here, can I get a prescription for Xanax?
Are you still having a stomach ache?
Stomach ache? What stomach ache? Hi, sir. I'm with registration. Can I see your ID to check you in?
Oh my god. Okay, so I've had a day. I was walking my dog like I normally do every morning, and out of nowhere, I started having chest pains.
Oh no, I don't.
So I turned around and went straight home because I thought, oh my god, I'm having a heart attack. But then, my stomach started to hurt.
Sir, please, I really just need your...
I think I was having anxiety from the chest pains. I don't know. So I went to the bathroom to poop because I thought that would help. And guess what I found?
I don't need to know.
I found this weird rash on the side of my butt. That's never happened before. What do you think that means?
Sir, you're gonna save that story for the triage nurse. I'm just here to check you in.
Oh, okay. I'm sorry.
No, that's okay.
I'm just scared.
Yeah.
Yeah.
So can I see your ID?
Yes.
Hi, my name's Austin. What brought you into the ER today?
I was at the park and I fell on my wrist.
Oh yeah, it definitely looks broken. It's a good thing you came in.
I'm also having some pain in my chest.
We'll get you an EKG and draw some blood for labs. We'll figure this out.
You're gonna draw my blood?
Yep.
Will drugs and alcohol show up?
Yes. Did you take anything?
I have to go.
Wait, but you have a broken wrist.
Ah! Oh no. Okay. I had some alcohol and I smoked a joint. Please don't call the cops.
Why would I call the cops?
Because I'm only 19. It's illegal.
No, it's okay. We're not gonna call the cops, even if it shows up in your blood work. We just want to make sure you're okay.
Really?
Yes, your health is our #1 concern. You should never hesitate to come to the ER, especially for chest pains or a broken bone, under any circumstance.
So you're not gonna call the cops?
No.
Are you gonna call my parents?
Not unless you want us to.
But I'm under their insurance.
The ER will send home a bill. They'll know you are at least here, but you have a broken wrist, so they're gonna find out anyways.
You don't send home the lab results?
No, trust me, it's gonna be okay. We're gonna take care of you.
Okay. Thanks, Austin.
But also, no more drugs and alcohol!
Yes, sir. Ben.
What?
Did you see Austin? The guy just finished his first ever night shift. He looks super tired. There he is. What's up, Austin?
Hey, guys.
Hey, Austin, your relief is running a little late. Can you stay for a few more hours? Okay. Wow, he is a broken man. We should totally mess with him. Rich, we are professional nurses. We do not play around. What'd you have in mind? We put apple juice in a urinal, drink it, pretending that it's pee. Classic. Here he is, here he is. Hey, Austin.
Guys, I need to speak to you.
1 second. I just need a quick sip of something.
What are you doing?
Oh, what?
I was gonna tell you, I got my patient's urinals mixed up with yours. I'm so sorry, I'm really tired.
Hi, ma'am. My name is Ben. What brought you into the ER today?
I'm 31 weeks pregnant and having really bad contractions.
Congrats. Baby's almost here. First one?
Yeah.
Okay, we're gonna get you up to labor and delivery right now. Is there anyone else with you?
My husband's parking the car. He should be coming in soon.
Yo, Ben, break time. Ready? I gotta take her to L&D first. Why's the floor all wet?
Oh no.
Is that?
Fuck. Did you just curse?
No. Oh my god, are we gonna have to deliver a baby? Dude, shut the fuck up. We are not delivering a baby in the ER. Why not? Because I've never done it before.
Aw, me neither. It could be our first time.
Focus, man! Right. Okay, what do we do? Ooh, I got it. Help! 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 What the? Dude! Help!
There you are. I've been looking everywhere for you. Hi, honey.
Oh, you dropped your water bottle.
I was looking for that.
Careful, you two. She dropped water on the floor. Dude, why did you freak out? I didn't freak out. You freaked out. Tips from the ER. The cast saw.
What the Yo, slow down! What if you accidentally cut the patient?
Impossible.
The blades of a cast saw can only move back and forth, which means it can cut through cast material like fiberglass, but when it touches human skin, it can only jiggle it.
My money don't jiggle jiggle, it folds. I like to see you wiggle wiggle.
Reasons people come into the ER to take their cast off. It's either too tight, painful, or you stuck something down there to scratch yourself and you lost it. We told you not to do that. Not to worry, we are more than happy to cut your cast off. But be warned, weeks of unwashed skin, well, that's gonna smell worse than your grandma's dirty coot.
Welcome to the ER. My name is Ben. How can I help you?
My husband here slept with someone and gave me an STD.
Honey, I told you, I'm not sleeping with anyone else.
You shut up, you lying son of a bitch! How else do you explain what's going on?
And what is going on?
It's very painful down there for me, and it hurts when I pee. That doesn't mean I gave you an STD. I said shut up!
Hey, guys, look. We're gonna figure this out, okay? But I need you to stop yelling. We're gonna run some tests. I'll be right back. Okay, ma'am, your test results are back. Good news is, there's no infection. You just have a bit of cervicitis.
I knew it! Wait till I tell your mother. I want him tested too.
Ma'am, cervicitis is inflammation of the cervix.
Okay.
I'm positive your husband doesn't have it.
How do you know? You haven't even examined him yet.
I don't have to, sir. You don't have a cervix. Dude, I don't know what that is, but while I'm here, do you think I could just get tested?
Welcome to the ER. How can I help you?
My vagina is on fire! Oh, okay. Give me 1 second. I'm gonna go grab a female doctor.
No, please don't leave. You have to help me.
Oh, no, ma'am. You don't have to take your pants off yet. Is that icy hot?
Yes, I use icy hot on my thighs after the gym.
Do you think maybe you accidentally got some icy hot down there?
I don't know. Maybe. What do I do?
We might just have to rub it off. If you give me 1 second, I'll go grab a female.
No, please. You can rub it off.
I understand, but I am not comfortable.
Just go down there and rub it off!
Ma'am, I am not going down on you, nor will I be rubbing you off. And I would appreciate it if you kept your voice down, okay? I'll be right back.
Hello, is anyone here? Hello, my God! Are you okay?
Yeah, oh, I'm fine.
Sir, you're bleeding a lot from your torso.
Oh yeah. Hey, can you get me something for that?
Can you tell me what happened?
No.
What do you mean? This is serious! Were you attacked?
Maybe, maybe not. Why? Who's asking?
Sir, please, I'm not the police. I'm only asking so we can treat you.
I ain't the type to talk, man. Just help me.
It looks like a knife wound. Did someone stab you?
I can't remember. Why do you want to know so bad?
Sir, please, we need to know so we can get you assistance.
Nah, man. Snitches get stitches. For real.
You're gonna get stitches no matter what! Now please tell me what happened! I'm getting a little sleepy. Can I just lay down right here? I'm just gonna lay down. Help!
Is that food?
Yeah, I gotta. What the?
Tips from the ER. Frequent flyers. It's what we refer to people who repeatedly come into the ER for non-emergent reasons. It's usually the homeless, just looking for some food and a warm place to sleep. They come in so often we know each other on a first-name basis. Hi, Carl. We're practically besties. If you're earning your unlimited ER miles, coming in once a week for vague chronic pains, substance abuse and misuse, or you have a psychiatric illness no one can seem to figure out, you will be flagged as a frequent flyer. That means that whenever you check in, a flag will pop up in your chart, letting us know that you likely don't need to be brought back. A doctor or a social worker will come see you in the lobby to hopefully and quickly resolve whatever issue you came in for. Again, it doesn't matter what ER you go to, the charting systems are connected. We see all your ER visits, how often, and what's already been said about you. Some patients like to get cute and change their identity to trick us. They'll claim they lost their ID, give us a fake name, address, and phone number. Motherfuckers. Just adding to the list of reasons why we can't trust each other. Tips from the ER. Constipation. If you haven't pooped for the last 6 days and the area between your stomach and your butt feels like there's a small child growing in it, you can come on down to the ER. We got options for your constipation. It could be as easy as giving you some stool softener pills, or we could stick a tube in your bum, shoot you full of warm saline water to manually loosen your poop until it comes gushing out like a geyser. It's called an enema, and it will get messy and uncomfortable. Specifically because we will ask you to hold that water inside of you for as long as you can. You may shed a few tears, but oh my god, you're gonna get the ultimate colon cleanse these silly juice companies could never live up to. If you don't want the poop water spilling out over your bed, get your ass to the bathroom. Don't you worry, motherfucker. We're not gonna make you walk across the hallway with the tube clenched in your bum. We're gonna get you to the bathroom first, turn you around, and then stick it in you from behind. Like two young drunk lovers at a club. Another option for your constipation is a disimpaction. That's when the doctor uses their fingers to manually scoop out the poop from your bottom. It's like a pooper scooper, but for your colon. Gloves may or may not be included.
When your friend works in emergency.
I cannot wait to try this soup. Kinda reminds me of that chunky vomit I got from that patient with an open head injury. How about we just go check out the pool instead? Ooh, we had a kid drown yesterday. CPR for an hour. No good. It was pretty horrible. Tonight's gonna be pretty fun, huh? You know what's not fun? Cancer. We diagnosed a 24-year-old this morning. Yikes. What do you think of this painting? Oh yeah. Looks like those maggots in that homeless guy's legs yesterday. They found him sleeping under a freeway. Guy should have been dead. Hey, you gonna eat that soup? No. Thanks. Alright, what do we got? 42-year-old female found lying on the floor for the last 2 weeks. Her husband said she fell down and he couldn't get her up because she's 450 pounds and has lymphedema. Oh my god. What made them finally call you guys? Well, turns out he was visiting her today and she said the sores on her back were becoming too painful. What? He doesn't live with her? Nope. Just comes by once in a while to bring her food and change the towel between her legs. Towel? What do you mean towel? Well, she can't get up to go to the bathroom, so... towel. Oh. Wow. Oh yeah, it took about 6 of us to scrape her off the floor and get her here. We had to cut the carpet underneath her because she was growing into it. Okay, I've heard enough. Room 1. You got it, boss. Red team, room 1, let's go! I can't take it. I literally can't take it anymore. Me neither. It's all I could think about. Guys, it's really not that bad. You just need to practice a little self-control. Not that bad. It's hell. I'm irritable. I'm agitated. I'm all blocked up. I found myself checking out the curves of a water cooler earlier.
Even if you guys back out, I'm gonna make it through to the end of the month, no problem.
You know what? I'm done. Here, take the money. Yeah, me too. You're a freak. We're gonna go masturbate. Separately.
Ew, duh. Masturbate? Hey, Austin, the vending machine gave me the wrong candy again. Do you want this Reese's peanut butter? Oh, no thank you. I'm observing No Nuts November this year.
Tips from the ER. Oxygen. When you come into the ERs, we like to measure how much oxygen is in your body. We measure this by percentage, and the hope is that you are 95% and above. Anything close to an A-, and you're gonna get some oxygen, motherfucker. We're kind of like Asian parents when it comes to this stuff. If it's not an A, you best believe we're gonna do something to make it an A. Thanks to COVID-19, a lot of you have been coming in way below 90, and we can't get enough oxygen in you to save your life. We gotta call the respiratory therapist to bring down their fancy equipment that shoots oxygen up your nose with the power of a leaf blower. This is called high flow O2. We gotta get lots in ya and fast, or your brain's gonna stop working. If you can imagine, this uses a lot of oxygen, and it's happening so frequently these days that I can't believe I'm about to say this, hospitals are running out of oxygen. That's right, motherfuckers. I didn't think it was possible either, but you refused to stay at home and isolate. You wanted your freedom. You said, give me liberty or give me death, and by all means, you're gonna get one.
Tips from the ER. Trauma shears. Have you ever woken up butt naked in the ER and wondered what the fuck happened to all my clothes? Well, if you've ever been in a traumatic accident and your unconscious body ends up in the ER, we're gonna waste absolutely no time cutting your clothes off with trauma shears. We gotta see what's underneath those clothes to save you. Gunshot wounds, broken bones, hairy nipples, we wanna see it all, motherfuckers. And we're gonna do it using these babies. They can cut through belts, leathers, denims, thin metals, or whatever else you Fashion Nova connoisseurs are wearing these days. Specifically designed to cut through clothes and not skin. Because we don't give a damn what you're wearing. If we want it off, we're gonna take it off. Tips from the ER. Top 5 Thanksgiving injuries. Food poisoning. If you're gonna cook a giant bird, make sure to thaw it all the way through before popping it into the oven. Just another reason not to eat turkey. It's dry and can kill you. Kitchen accidents. Cuts, lacerations, grease burns on your ball sack. Nothing will increase your chance of kitchen injuries more than the stress of preparing a Thanksgiving dinner for a family who doesn't appreciate it. Alcohol and drunk driving. People will get drunk and they will insist on driving. If you see your drunk cousin reach for his keys, punch him in the throat, zip tie his hands behind his back, and throw him in the trunk of an Uber. Overeating. Put the pumpkin pie down, motherfucker. You've already unbuttoned the top of your pants. What else are you waiting for? The slow onset of death from hypertension, indigestion, and heartburn? Drop the fork and get the Tums. Overexertion. Take it easy with the early morning physical activities. Stretch before your turkey trot races, loosen your hips before your football games, and if you plan on finally swinging at your in-laws, warm up that shoulder and make it worth it. Tips from the ER. Dog bites. I know it's been a rough year for you. You've been sad and alone, and you thought getting a dog was going to solve all your lonely problems. You brought that mutt home, gave it nothing but love and trust, and how did it repay you? By chomping you so hard, you'd question why you'd ever let a canine so close to you in the first place. You were drunk, weren't you, motherfuckers? Admit it! A dog's mouth is full of bacteria. That's good for them, bad for you. If you get bit by a dog, there's a chance that bacteria has infiltrated your body. You'll know because that dog-bitten area will soon become big and red, which means you're probably infected. Luckily, a quick trip to the ER for antibiotics will solve all your sad puppy problems. Here in California, we will have to report the pup that mauled you. It's not that we don't love him, it's just that if it does it again, we're gonna have to put him down. I'm just kidding, we wouldn't hurt him. We're just gonna turn that bitch in. As for your wound, we're gonna have to wash it out with saline. Get rid of that good doggy mouth bacteria before we patch you up and send you home. Rough. Tips from the ER. Who is John Doe? If you end up in the ER unconscious without any sort of identification, congratulations! You're officially a John Doe. Or Jane Doe, depending on what we see down there. We do not have time to correctly identify your pronouns, Skylar. You're dying. Not being able to identify you presents the ER with multiple problems. 1, we have no access to your medical records and allergies, so we won't know what medications won't kill you. 2, if we don't know who you are, then we won't know who to bill to get paid. So wake up, motherfucker! Eventually, one of 3 things will happen. You wake up and tell us who you are, or someone calls in looking for you and they tell us who you are. Or you stay unconscious and unidentified forever. becoming a nice little decoration for the hospital until you breathe your last living breath. So make sure to bring your IDs. Tips from the ER. Avocado hand. It's one of the more common hand injuries you'll see in the ER, which is expected when people are slamming their knives full force towards a hard, slippery seed. It's gotten to the point where I would suggest you stop eating avocados for your own safety. But Steven, everybody needs to eat good fats. If that's the case, maybe I'll take a bite out of you. My point is, you're not a master chef, and unless you were trying to make bloody guacamole, I suggest you slow down in the kitchen when cutting one of these things, or you're going to end up in the ER with a handful of stitches, wondering how you're going to pay for this medical bill after you just spent last week's salary buying 2 avocados. If you really must eat avocados, I suggest doing it this way.
So you're going to put your index and middle finger in between the pit with your thumb on the back and just...
Tips from the ER. Abscess. An abscess is like a giant pimple growing somewhere on your body. It's a painful swollen lump filled with pus because it's infected. And unlike this giant zit on my face, motherfuckers, if you come into the ER with an abscess, we're gonna slice that baby open and spill all its gooey goodness. First thing we're gonna do, wipe you down, get you some numbing medication, and then we're gonna cut right down the middle. We'll be sure to be properly geared up because if this is your first time, we won't know if you're a squirter. Once open, we're going to use whatever we have on hand, tools, gauze, fingers, roll it around inside of you to pull out every last drop of juice. Once empty, we're going to stuff your new body hole full of gauze and let it marinate for a couple days. After 1 to 2 days, we pull out all that delicious cotton filled with blood, meat, and pus, patch you up, and send you on your way. Worst place I've ever seen an abscess? Right between a man's ball sack and his booty hole. Safe to say he got all the numbing medication the ER had to offer. Tips from the ER. Cinco de Mayo. It's that time of year again. Time for cheap margaritas, sombreros, and coronas. We're going to celebrate Mexican culture in the most over-the-top, inauthentic way possible by consuming copious amounts of Mexican beers made popular by American advertisements. The OG Cinco de Mayo is associated with the city of Puebla, where a small-time underdog Mexican army resisted a big French invasion on Cinco de Mayo, 1862. But who gives a shit about that when restaurants across the US of A are handing out $3 tequila shots? Drink enough of those and you won't remember any part of history. As a friendly reminder from the ER, we'd like to ask you motherfuckers to stay safe and drink responsibly. Look both ways before crossing the street, and if you're too drunk to drive home, sit your bitch ass down, put on a movie, I suggest Coco, and go the fuck to sleep. Wouldn't want you to end up in the ER, mi amors. Happy Cinco de Mayo, motherfuckers. Tips from the ER. St. Patrick's Day. It's that time of year again. Get your leprechaun costumes and shamrock undies on. We're gonna go celebrate another holiday we don't fully understand by consuming copious amounts of green drinks, green food, and anything else green you can possibly get your filthy little hands on. Not the plant, Charles. That's for display purposes only. Here in the ER, we'd like to pointlessly remind you motherfuckers to drink responsibly. St. Patty's is the type of holiday where you start slamming Irish car bombs the minute you wake up. So we're going to be ready from sunrise to sundown with vomit bags aplenty to catch all that green gooey goodness your bitch-ass tummy couldn't handle. You'll likely be drinking outside, so remember to layer up. Contrary to popular belief, consuming alcohol actually lowers your body temperature, so you freeze quicker. But it doesn't matter what I say here. You will no doubt find a way to end up in the ER. So we'll be here, sipping whiskeys and stouts waiting for you. Slanche. Tips from the ER. No more mouth-to-mouth. I know how disappointing this is going to sound to some of you, but you no longer have to do mouth-to-mouth for CPR. They actually changed that rule over 10 years ago. It's kind of gross that they had to do mouth-to-mouth in the first place. You're telling me I have to put my lips on some random stranger in the streets? Hard pass. Actually, what do they look like? If you see someone unconscious, not breathing, and without a pulse, call for help and immediately start chest compressions. And only chest compressions. Stay the hell away from their mouth, you sick motherfucker. Start chest compressions and do not stop chest compressions until help shows up. Make sure you're giving that chest a good hard push, because remember, what you're doing is manually beating the heart. And the longer you can keep that heart beating, the better the chance they have at surviving. Hell, they might even wake up and thank you with some good old mouth-to-mouth. Tips from the ER. Motorcycle accidents. One of the most common traumas in the ER. We get them all the fucking time, and it's not hard to see why. Motorcycles offer absolutely no protection during a motor vehicle accident. Best case scenario, you break a couple bones. Second best, you die. Because the worst case scenario, in my humble opinion, is that you suffer a traumatic brain injury, leaving you paralyzed and your poor mother as the only person willing to wipe your ass after you shit all over your bed. But hey, at least you look good in a motorcycle jacket. Just try not to hit anything on the freeway. Some of you even like to knock back a couple drinks before you ride. Daredeviling motherfuckers, aren't you? Even if you are wearing a helmet, flying off your bike at 70 miles per hour isn't exactly a recipe for survival. You'll probably die instantly. Best way not to get into a motorcycle accident, never get on a motorcycle. Tips from the ER. Crack in the chest. What happens when you get shot, stabbed, or hit so hard in your chest your heart starts to bleed out? Well, we gotta get to it and plug it up, don't we? You won't be able to live too long if your heart's leaking blood where it's not supposed to. Luckily for you motherfuckers, some sick bastard sliced open enough bodies to solve this problem. It's called a thoracotomy, or as we like to refer to it as, crack in the chest. We find a nice soft spot between your ribs, slice open a hole. Left side of your body, of course, that's where your heart lives. We then take a crank, shove it into that hole between your ribs, and crank you open. Move that flopping lung out of the way, locate that hole in your heart that's bleeding out, shove a finger into it to stop the bleeding long enough to get you up to the OR to save your life. Easy. Back in the day, crack in the chest was actually how they administered CPR. They'd find you down, slice you open, and manually pump your heart with their hands until they realized this probably does more harm than good. Let's stick with chest compressions. Tips from the ER. Body bags. It's bound to happen, motherfuckers. Not everyone who comes to the ER is lucky enough to leave alive. Sometimes you gotta get pushed to the morgue. But we're not just gonna push a dead body through the hallways for all the world to see. That's disrespectful. We're gonna wrap you up really nicely and then zip you up in a body bag. First thing we do, roll your body around to get the body bag under you. There will likely be poop because when you die, all your muscles relax. So if there's any poop left inside of you, it's gonna come spilling out. We tie your feet together, tie your hands together, and then tie your jaw closed so your face has some resemblance of what it used to look like when you were still walking around. Normally we would pull out every IV and tube we stuck into you trying to save your life. But if the cause of death is unknown and you need an autopsy, we're going to leave everything as is to distinguish your injuries from our appropriate medical interventions. You're welcome. Hello, welcome to the ER. How can I help you? This is my daughter Sarah, and she's bleeding a lot from, between her legs. We're going to get you seen right away, okay? Sir, would you like to come back with her? Oh no, I'll wait here. So it looks like your daughter is actually having her first period. What? Is she going to be okay? Yeah, she's gonna be fine. It's actually very normal for her age. She didn't lose too much blood, did she? Nope, she's perfectly fine. We're actually getting her discharged right now. Oh my god, thank you. I was so worried. How do we stop this from happening again? You don't. Hello, welcome to the ER. How can I help you? I got shot in the leg. Oh my gosh, someone shot you in the leg? I was putting my gun back in my pocket, and it went off. You shot yourself in the leg. Yeah, it was an accident. But this is an ER. Don't you see this stuff all the time? No. Tips from the ER. Cold turkey sandwiches. You've probably heard of them. The emergency room special cold turkey sandwich. More bland than your boyfriend's personality, drier than an 87-year-old's G-spot, and tasty as a brick. Fully equipped with one sad piece of lettuce and one slice of an unripe tomato. These legendary sandwiches have been feeding generations of patients the bare minimum nutrients necessary for survival. Don't be afraid to ask for as many mustard and mayonnaise packets as you like to drown out the sorrow of these sandwiches as they turn into dust in your mouth. They're available year-round, day and night. Wash them down your gullet with some delicious fruit juices. Apple, orange, cranberry, baby, we got the works. Some places even got the purple stuff. No, we do not carry Sprite in the ER, but if you find a sucker to call down to the kitchen and bring you up one, motherfucker, you won the jackpot! Just don't let them know that I told you how to do it. Tips from the ER. Staples. If you come into the ER bleeding out from a gash in your head because you were too busy taking a picture for the gram instead of keeping both hands on your bike, don't be surprised if we staple you back together. That's right, motherfuckers! Staples are a quick and easy way to close up a wound. You just hold the skin together and pop, pop, pop! No anesthesia necessary, and it'll go down in history as one of your quickest ER visits. We would never staple you directly on your face. Can't risk your moneymaker looking like Frankenstein put you back together. We gotta make sure you stay sexy.
Also, never try this at home. This isn't your everyday office stapler. We use a new sterile one every time. After a couple days, you come back, I get to yank them out of you, and you get to leave the ER looking fresher than a prince in Bel-Air. Tips from the ER. We don't know what's wrong. That's right, after all the poking, prodding, touching, and undressing, your scans, your blood work, and your labs came back, and we can finally tell you that we have not one motherfucking clue why you are in pain. You think you'd be happy to hear that nothing's wrong with you, but you motherfuckers hate that answer. You'd rather be told you were dying. At least that would justify why you stressed out, rushed to the ER, and spent 6 hours at the hospital. Instead, you got handed the biggest set of blue balls the ER has to offer. Sometimes all you needed was a day off, ibuprofen, rest, and a better diet. If something hurts to move, stop moving it. Hurts to move your arm? Stop fucking moving your arm. Learn some physical therapy. You'd be surprised how many people have no idea how to use their own bodies. Anyways, thanks for coming to see us. That'll be $2,000. Tips from the ER. Foley. A Foley is a tube we stick in you when you're having a little trouble getting your pee-pee out. It's pretty painful and dangerous not being able to urinate when your bladder's full, but luckily for you, there's a special tube that'll drain that tinkle right out of you. It's called a Foley, and it goes in exactly where you think it does. Right through the hole where the pee-pee comes running out. Once it's in, we blow up a little balloon at the tip of the tube to make sure it doesn't try to snake out of you, so don't pull on it, or it's gonna be a bloody fucking mess. Once it's in, we don't even have to turn it on. It automatically starts draining, and you feel better. It's pretty painful going in, but don't you worry. We're gonna lube up that Foley like it's your first time, every time. That's right, motherfuckers. Welcome to the ER, where there's no tube we won't try to stick in you to help us help you. Tips from the ER. Restraints. We here in the ER are happy to help you stay in bed if you can't do it yourself. Whether you're aggressively drunk, methed out, or just plain annoying, we're gonna tie you down. I told you to stop walking up to the nursing station. We will come to you. Restraints are what we use when we've had it with your physical activity. We call our trusty security guards, everyone grabs a limb, and we strap you to the bed. Depending on how naughty you are, we can tie just your wrist or include your ankles. Kinky motherfuckers, aren't you? Try spitting on us, and we're gonna take care of that too, by putting a spit bag over your head and hoping you don't throw up. Can't have you drowning in your own vomit. That'd be bad. I've had to tackle patients, and I've had patients tackle me. You may get one good swing in, but after that, rest assured, we're gonna swarm you faster than a Best Buy on Black Friday. Tips from the ER. Code Red. Ah, yes. We're all too familiar with the sweet deafening sound of a fire alarm. If you hear Code Red, it means somewhere in the hospital, there's a fire. If this is the case, you'll notice people around you trying to close all the doors. This may feel like they're trapping you in a burn, but they're actually trying to prevent the fire from spreading too quickly, if there really is one. I've experienced so many Code Red drills that I've become completely numb. I can't remember the last time I picked my ass up and left the building because of a fire alarm. If there really is a fire, my ass will be burnt to a crisp. But this doesn't have to be you. Save yourself, motherfuckers! If you see a fire, implement RACE. Remove from danger, sound the alarms, contain the fire, extinguish if safe, and evacuate your ass. Code Red! Tips from the ER. What's happening in the ERs right now? We are all out of motherfucking space! Every admitted patient who is supposed to move out of the ER is currently stuck because every bed in the hospital is currently occupied by sick-ass patients. The ER is more backed up than your colon after a weekend of binging Fat Tuesdays and buffets in Vegas. On top of that, every patient in the ER is COVID positive. You want to know what's separating those patients from me and you if you come into the ER? Curtains. Motherfucking curtains! We are surrounded by COVID patients and we are being protected by the all-powerful barrier of a fucking curtain. If this wasn't a sign to stay the fuck at home and put the damn mask on, I don't know what you're waiting for. Death? Hello, welcome to the ER. How can I help you?
I'm here for my son. I was picking him up from school and I noticed he's a lot shorter than some of the other kids.
Okay.
Is there something you can give him right now to make him taller? What are you laughing at?
You serious?
Yes. Is there something you can give him right now to make him taller?
No.
Can I speak to someone who's in charge?
Hello, welcome to the ER. How can I help you? I think I'm having a heart attack. Oh, can you tell me a little bit more about what's going on? What does the pain feel like? It feels like a heart attack. Have you ever had a heart attack before? No, but my mom has, and this feels just like it. Follow me. Tips from the ER. Flu season. Top reasons to get the flu vaccine this year. Number 1, so you don't die. That's it. That should be the only reason you need, motherfucker. Flu season is officially upon us, and we are dealing with 2 population-destroying viruses. Luckily for you, someone spent a lot of time and money to find the vaccine to one of these crazy viruses. So, what are you waiting for? Get your bitch ass to a clinic and get this vaccine before you end up getting sick, having to come to the ER and complain about why it's taking so long for you to be seen.
Things new moms have said in the labor and delivery room.
I can't wait to smoke a joint after this. Tell that bitch to get in here to see if I'm dilated enough to get the epidural yet. Oh my gosh, I wish I was a lesbian right now. If I ever say I want to do this again, shoot me with a paintball gun to the tits. My allergies are shellfish, and just now, my husband's pee. Did someone pour lava on my vagina? I don't want to poop. Can we put a butt plug in? Oh my god, it feels like a bowling ball is coming out my ass. Can we get takeout? I'm tired of delivery.
Which one was your favorite?
Ugh, I am so hungover.
Morning, Ben.
Dude, keep it down.
What's going on?
I'm waiting for Rich to give me an IV. I'm so dehydrated.
Are you allowed to do that at work?
Yo, bad news. The boss is still walking around, so you're gonna drink a liquid IV in the meantime. Why do you keep trying to make me drink that stuff?
Because it works. We had the same amount of alcohol last night. I drank one of these before bed, and now I feel great.
Can you put it in a needle and stick it in my vein?
No. This is really good. I know, right?
I'm never drinking again.
Things new moms have said in the labor and delivery room part 2.
I'm never doing this again. We should have done Admiral. Get the salad spoons and get this effing child out of me. If I wanted to watch my ass blow apart, I'd eat 12 Gordita crunches and twerk on the sink of a Walmart bathroom. I'm going to name my kid Epidural. Who shoved a stick of dynamite up my ass? It felt good when it went in, but it's a real motherfucker now that it wants to get out. I just really don't want to know if I'm pooping. After this, I'm going to be really glad my husband's pee is small.
Which one was your favorite?
Tips from the ER. Abdominal pain. What happens when you come to the ER with abdominal pain? We would tell you to stop eating and drinking. That's right, motherfuckers! If you have an upset stomach, stop fucking with it by giving it shit to do. I don't care what your grandma said about the healing powers of Sprite. We will slap it right out of your hands. If a part of your body hurts, it needs rest. If you rolled your ankle, you wouldn't walk on it. If you threw out your back, you wouldn't lift with it. So stop fucking with your stomach by forcing shit into it. At least until the pain subsides. Have a good day.
Okay, Susie, we will need a urine sample from you. Is there any chance you could be pregnant?
No way.
Are you sexually active?
I was, but not anymore.
What does that mean?
I haven't had sex in like 4 weeks.
Okay. And were you using protection?
Why does that matter?
Just give us the urine sample, okay? You're 6 months pregnant.
What?
Dude, why are you crying?
Shut the fuck up, Kyle!
Okay, you don't have to be a little bitch about it. What happened?
I walked into the kitchen. My dad was cutting up onions.
You're being a little dramatic, don't you think?
Onions was such a good dog.
What the f? Hello, emergency room. How can I help you? Hi, can you tell me how long the wait is to be seen? It's hard to say right now. We're pretty busy. Okay, well then can you put my name down on the list? We don't take reservations at the ER, ma'am. Well, do you know how long I'll have to wait if I show up in 20 minutes? It's really hard to say, ma'am. I can tell you the person who's been waiting here the longest has been here for an hour. Well, do you think I'll have to wait an hour if I show up in 20 minutes? It's really hard to say, ma'am. Just depends on whoever walks in through those doors in the next 20 minutes. Well, this is ridiculous. I'm having an emergency. I have no doubts that you are, ma'am. Hello, what brought you into the ER today? My friend just came in as a patient. John Doe? I'm so sorry. We're only letting family members back at this time. Oh, I've known him all my life. We're practically brothers. Right. So, unless you're an immediate family member or a patient, we're gonna try to limit the amount of people coming into the ER right now. Well, then I'll check in. And what's your emergency? Headache. Alright, follow me. Can I get a room next to my friend? Get out.
Hello, what brought you into the ER today? Yo, I need an IV stat for this massive hangover. I'm sorry, sir. We don't provide IVs in the ERs for hangovers. Isn't that the best way to get rid of a hangover? It is, but it's gonna cost you like $1,000. Well, how much for a Gatorade then? I don't know, maybe $2? Fine, I'll take it. Bring me a Gatorade. Sir, the vending machines are outside. Ugh, useless. Good luck.
Hello, welcome to the ER. How can I help you? I think I'm having an allergic reaction. Do you know what you're having an allergic reaction to? An edible that my friend gave me. Were there nuts in the edible? What are you allergic to in the edible? I think I'm having an allergic reaction to the THC. Are you having any trouble breathing right now? I don't think so. Am I gonna die? Nah, probably not. Tips from the ER. CPR. It is not necessary to do mouth-to-mouth when performing CPR. That's right, motherfuckers! Stop putting your lips on random strangers. It's gross. Nobody in the hospital does it, neither should you. Guys, I don't care how hot she looks. Get off her, you sick bastard! When in doubt, focus on chest compressions, push fast, push hard, to the tune of BG Stayin' Alive's chorus. Hello, welcome to the ER. How can I help you? I was here last week, and they gave me an inhaler for my cat allergy, but it's not working. I'm so sorry to hear that. And are you using it every day? I've been using it on my cat every day. What do you mean you use it on your cat every day? I spray it on my cat every morning. Do you think I should start using it twice a day? Oh, thank God we made it. Hey, do you think they allow laughing in Hawaii? What? Or just aloha? Why do you do this? I thought it was funny. Hey. What? I have a question for you. This better be a real question. Why should you never lie to an X-ray technician? Nope. Nope. Because they can see right through you. Hi, ma'am. So we will need a urine sample from your 6-year-old son, okay? He hasn't been able to pee all morning. Well, we could try taking him to the bathroom one more time. If that doesn't work, we will have to put a catheter in him. Put a catheter in him? Would that break his hymen? Would he still be a virgin? No. And yes, he should still be a virgin. All good questions. Tips from the ER. Free things you could ask for in the emergency room. Antibiotic ointments, individual packets, and sometimes the whole tube. Wound care supplies, gauze, tapes, dressings, band-aids, wraps. You can never have too much. Take a whole bag home with you. Clothes. Now it varies from hospital to hospital. If you're lucky, you can get a fresh pair of sweats. But no matter where you go, you can always get hospital socks. How about some toiletries? Toothbrush, toothpaste, lotions, shampoos, soaps, combs, earplugs? We got it all. And of course, feminine products. Pads and mesh undies. Ooh, so soft. Tips from the ER. Most of the time you motherfuckers come in, we give you an IV, we get you a bag of saline. What does that mean? We're hydrating you. Imagine that. Your body needs water. Wow, what a concept. Drink up, people. Stop crowding the ERs.
What the doctor is saying versus what they actually mean. It's chronic. It's been happening for a long time. It's acute. It just happened. It's benign. It's harmless. It's idiopathic. I have no idea why it's happening.
Okay, so I'm gonna add a little pressure now, sir. It's alright, it's perfectly natural.
That was you.
Yeah, I know, but it's still perfectly natural.
What happened today? I hit her. I said, 'cause she hit you, huh? Nope. Did she say something mean to you? She didn't get a chance.
So you're Asian, right? Yeah. So what kind of knees are you? Knees?
Knees, like Chinese, Japanese, Vietnamese, Korean knees.